Good afternoon. Thank you for having us here today. I'm Kevin Webb, the Senior Manager of Housing at the Calgary DropIn Center.
Hello everyone, my name is Emily Gunn and I'm the manager of our Transitional Housing programs at the DI. Before we get into our presentation, I just wanted to start with a quick land acknowledgement as we are connecting with you from Treaty 7 territory, which is where Calgary is located. The Calgary DropIn Center acknowledges that we are connecting with you today from Treaty 7 territory, and we respect the history, languages, and cultures of the people of the Blackfoot First Nation tribes of Siksika, Piikani, Kainai, the Stoney Nakoda First Nations tribes of Chiniki, Bearspaw, and Wesley, the Tsuut'ina Nation, and the people of Métis Region 3, all of whom continue to enrich our community.
We thought it would be important to start off today by talking a little about the Calgary DropIn Center. So the Calgary DropIn Center is a housing-focused emergency shelter. A housing-focused emergency shelter strives to keep a person's time without a home as short as possible by connecting people to safe, permanent housing. If you want more information on what a housing-focused shelter is, I suggest that you check out the Canadian Shelter Transformation Network at transformshelter.ca. So today we're here to talk about why a hotel model needs to be a transition to housing and not just an extension of shelter. So like many shelters across Canada, the DI was faced with the ever-changing landscape due to COVID-19. In response to physical distancing requirements, we partnered with the Calgary Homeless Foundation on a hotel model. As a housing-focused shelter, we wanted to ensure the facility did not become just an extension of the emergency shelter, but really a transition into housing.
So this is a nice little picture of the hotel that we used for this model. We were really fortunate to partner with the Super 8 Hotel here in Calgary, as they were not able to maintain their regular function because of the travel bans. So we were kind of able to mutually benefit from working together on running this program. So we were here running our transitional housing program from June 2020 till the end of November 2020. The hotel had 83 rooms that we were able to use for single occupancy. And on site, we were able to support everything they would need from the start to end of the day. So we were able to bring 3 meals a day on site. There was laundry available, as well as 24/7 DI staffing and security with the additional support of the hotel team. So their housekeeping, their front end team, their maintenance team. So we were all kind of able to work together to keep this program functioning as well as it did. The kind of cherry on top of our program is afterwards we were able to pilot a continued case management program for a couple months to continue providing some community support for the folks that we had recently housed in community. Another thing that was really cool about having the free reign to utilize the space to be really intentional towards housing is we were able to add other things to our environment to help with that housing journey. So when you'd walk in, there were housing posters. We were able to post rent faster ads, as well as get a client computer on site so that folks can, while they may be working with their case managers, they could also continue to do some of that work independently. So it really turned out to be a great environment to be really active in our housing goals. So over the 6 months, we worked with 151 total participants. When we were bringing folks into the program, we did not restrict based on gender. So we were able to accommodate anyone who was as excited as we were to work on housing. The other piece of this program was really being mindful and trying to prioritize folks who were at high risk of negative outcomes from COVID-19 if they were to get sick. So that's folks with respiratory illness, other chronic health issues, some of our seniors who would really benefit from having a smaller environment with more privacy and more physical distancing. Probably one of the most important things that we were really clear from the get-go with our clients was the expectation that this wasn't just another shelter, this wasn't a winter response program, this was a housing program. and we wanted to make sure that anyone who was coming to work with us on site was motivated to work on housing, because we wanted them to voluntarily participate. We didn't want anyone to feel forced. For this environment, we were able to think really creatively with our staffing model. So that involved having case managers, not just doing the case management work where they are often secluded into an office and booking appointments with people, but they were really running the facility on the day-to-day. So between working with the folks on their caseload, they were also helping hand out meals. They were helping do some of the independent daily living support for folks who are having to quickly learn how to change the sheets on their bed and do their laundry. They were really able to be involved throughout the entire day with everyone in the program. And what was really wonderful about that is that just increased the opportunity for housing-focused conversations. Instead of just passing laundry detergent to someone, it was, wow, isn't it nice to be able to do your laundry in privacy? Do you know how to do your laundry? Or how are you going to unpack your belongings into this space? How are you going to move into this room? Does this look like you will want it when you move out on your own? So just being really intentional that housing was very much on the forefront of all of our minds throughout all processes of the day. Additionally, we were able to have the 24/7 supportive healthcare team, which we really wanted to have available, considering we were bringing folks with some health conditions and that put them at risk of negative health consequences. And they were really helpful for us to ensure that we were doing our best to do appropriate COVID-19 screening. Just a little nugget that maybe should come up in outcomes, but I want to say it here, is through the 6 months, we were able to not have a single COVID-19 outbreak. So just another, contextual thing of how amazing it was to have this space is we brought our sickest folks into this environment and none of them had got COVID-19 while they were here. And that, I think, was really part of why our staffing model was so successful, in that we were able to support folks with their health throughout. So that I stopped rambling, we were also staffed 24/7 with adult care workers and security, as well as the hotel staffing.
So speaking of outcomes, as Emily mentioned, we had 151 participants in the program. We were able to actually house 128 individuals in the 6-month time period. We did have 25 discharges. They ranged. There was some people that were beyond level of care, some inappropriate behavior. There was some people that voluntarily withdrew from the program. And then because of the program closure, we actually had to bring 6 people back to the emergency shelter, but continued to work with them with our internal housing teams. We supported 117 males and 11 females throughout this time. That is really kind of the normal ratio we see within our building when we look at our general population. We broke down the streams of housing. So Calgary does have a coordinated access and assessment. And you can see here that we housed 12 people through that stream. I think the really important number is that 113 of the individuals were housed independently, so completely outside the system of care. One of the targets that we initially had set out was that we wanted to get people housed within 30 days. It was a pretty lofty goal that we had set for our teams. And when we looked at the data at the end of the program, it was around 60 days for both genders to obtain housing. So if you're looking at doing this program, kind of target that 60-day mark. Wanted to pull up and look at the shelter stays of individuals and kind of dig into a couple people. It's really important, and we can't stress it enough, that this type of program, anyone that is accessing emergency shelter, no matter the length of time of their stay, if they're episodic or chronic, or brand new to homelessness can all benefit from this type of environment. So you can see we had one male that we housed that had 4,813 unique shelter stays at the DI. That's equivalent to about 13 years of homelessness. And then on the lower side, you can see that we had a female that was brand new to homelessness. We have our diversion program that felt that this individual would really succeed in the program. So we transferred the individual to the hotel and were able to get them into permanent safe housing within actually 15 days of becoming homelessness. The second stage of the data that we wanted to collect was really looking at not just the housing numbers, but what was the quality of life of the individuals that we helped obtain housing. So we did a voluntary survey with clients 3 months after they were housed. We actually got 54 participants that agreed to do the survey. And this is just a snapshot of the 16 different questions, but you can see here that 59% of the people reported that the amount of sleep that they get has increased. 72% of people said that their outlook on life had increased. 50% of people said that the amount of their drug use had decreased. 38% of people said that the amount they drink had decreased. And then 55% of people said that their overall mental health had increased. You know, with these data sets, I think one of the best pieces of data that I heard while being down at the hotel was a client told me that he had forgotten what it was like to live in his own apartment. And that was, I think, you know, we can look at data, but hearing that directly from the client is way more impactful.
So we really wanted to ensure that everyone left this presentation today with, you know, we wanted to give a snapshot of what this program looked like and actually how it ran, but we really wanted to focus on some of the keys to success that we thought helped make this program so successful and something that we as an entire agency are super proud of, and we love talking about it. One of the most important things is doing that triage work on the front end to ensure that you're bringing folks into that environment that really suit the environment. So one of those is, you know, managing acuity. We tended to bring folks who were on that medium to low range of acuity, just because we wanted to ensure we're bringing someone into that environment that can do well in that environment. We wanted to make sure we were taking a harm reduction approach and ensuring that the folks that we were working with were less likely to have pretty severe negative outcomes just from the environment itself. The second piece is being really, really intentional and really vocal about the housing goal so that everyone who chooses to join the program is bringing that housing interest in with them. Some folks that waned and it kind of fluctuated through their time, but for the most part, every single person there was as excited as the staff was to work on housing. And that was really important because otherwise they were going to get sick of us talking about housing every moment of the day. A couple of the ways that we were able to be really clear and intentional with that goal of making this a housing program and not just another shelter environment was utilizing some pretty clear service agreements and building and program guidelines that kind of put some structure and held both the participants accountable to the environment, but also the staff accountable to the individuals there. We wanted to make sure if we're telling folks that we want to house them within their time there, we wanted to make sure that we were being accountable to that goal and working as hard as we can to accomplish it. Something that we've kind of touched on as well is how awesome this was to mimic a housing environment, and how many opportunities there were to connect and really engage on what it means to live in housing. Kevin mentioned someone talking about having an apartment for the first time. In our DI shelter, there's approximately, there's really maybe 3-4 bathrooms per gender per floor. So you might be sharing with dozens of other people. In this hotel environment, when was the last time some of these folks had their own bathroom? They could shower when they wanted. They could use the bathroom when they wanted. And, with that, there's so many things that you can revisit and learn and connect with folks about, and how do you clean a bathroom? How often should you clean a bathroom? How do you get toilet paper when there isn't staff who just will do it quickly on their own? So we were really able to dig into all of those people with participants and provide really individualized support that really lines up with the level of some of those independent daily living skill developments that they needed. Another piece of this program was because we had such a huge goal of trying to house folks within that pretty structured 6-month timeline, is we knew we needed to be prepared as a staffing team and provide really intentional training. So with our case managers, we really dug into what case management was, what are strategies of case management, and then for our entire team, we wanted to make sure they understood the bigger housing system of care, who kind of would work best in different environments. How do you have conversations with participants about what type of housing supports they might need, and really making sure that we are maximizing that time. We didn't have time to learn as we go. We had to be prepared. Housing location, working really intentionally on how to find housing, as well as what are things we might want to look for when we're looking for housing, where their doctors are. Additionally, we wanted to have pretty clear procedures in place for our team, and we wanted to make sure that everyone had at least a basic knowledge of the Residential Tenancy Act, that provides kind of the backbone to what we're doing in our housing work, and really support clients in learning it too, so that when they're living on their own, they understand their rights when they're supporting their housing. Part of the training too, I mentioned briefly when we talked about the facility, how awesome it was to have the hotel staff still there. And we really realized how people in the service industry working in these hotel environments, they have all of those one-on-one personable skills that really made them excellent partners throughout this journey. But then we were able to give them a bit more information on, maybe the housing system of care, maybe what are some outreach community resources to support folks who may not have housing. And we learned from them how to kind of manage that type of environment. So it really turned into a beautiful partnership that we were really fortunate to have.
Before we get into what we've been doing since, wanted to just talk about the mimicking of a housing environment. By doing that and giving the clients an ownership piece of their own unit, at the end of the program, we actually only ended up with about or just over $9,000 worth of repairs required. And then, we talk about acuity and how we looked at that mid to low acuity clientele. And I know some of you are probably sitting there saying, well, my shelter's all high acuity. I'd like to challenge you to take some time to really dig into your clients and look at your own internal triaging. Because there are people in every shelter that can be housed in those independent placements. It's about, going out and finding them. So what have we been doing since? We did run one more transitional housing model. It was a smaller scale with only 20 rooms. We did try a different staffing model where we were using our shelter frontline workers. It was incredibly successful. I think one of our learnings is that, we had to spin it up really quick, so we couldn't do some of that intentional training that we wanted to do. We had to do it more on site. And our smaller program, we did try to do it with a higher acuity population, and we were still able to flip that building once and house just over 20 people in a shorter period of time. We are continuing to develop our own internal housing placement triage tools. this has come out of COVID. When we've had to move from shelter to shelter and do all these different things, we realized that we needed our own internal system to really identify who the clients are that we're truly working with. Because, at times we've said the same thing, oh, all our clients are high acuity, but when we started to dig into it, we realized that that's truly not true. And then we also continued that community case management piece. One of the things we identified with that program was that there was this group of individuals that could be housed independently without rental supplements, but needed that little bit of case management help just to get over those first couple months of housing. A lot of these individuals would probably have gone to our coordinated access and assessment table for a Housing First program, but we're able to, just help them with the case management piece without those additional rental supplements. And then we want to share our experiences with all of you guys and with every other service provider and stakeholder that may want to. I've been really fortunate to work with a number of shelters across Canada on this program model, and we are always willing to share anything and everything that we're doing. So if you're looking at doing this, please feel free to reach out. And you can reach out to myself at kevinw@thedi.ca or Emily at emilyg@thedi.ca. And I'd like to really thank everyone for listening to us today and hearing about this program that we ran.
Thank you all so much.